the incidence and pattern risk factor and outcome of the retinopathy of prematurity in North Karnataka. Chief author is Sandeep Patil. Presenting author Dr. Ishan GOYAL. Yes, you can start.
Uh, Good evening, everyone. Thank you, APAO AIOS, for this opportunity. The title of my presentation is the Incidence, Patterns, Risk Factors, and Outcomes of Retinopathy of Prematurity in North Karnataka. Now, ROP is one of the most widely recognized causes of visual impairment in preterm babies. In emerging economies like India, we are undergoing the third epidemic of ROP. Now, a lot of studies have been done around in babies of around 1700 grams, but very less studies are available for babies up to 2 kgs. So now these babies would have been missed by American and British guidelines. So it is very much necessary that we stick to Indian guidelines as per RBSK. So our research objectives were to find out the incidence, the clinical profile of these infants, and study the patterns of ROP and outcomes of infants in these babies. So it was a prospective study from 2023, April 2023 to March 2024, and patients were screened as per RBSK guidelines. Each baby underwent wide field digital imaging, and baseline characteristics were noted as per ICROP3. Staging and zone were defined. So if it was an immature retina, we followed it up till it was mature. If ROP was present, then we managed according to ETROP study guidelines. Now, the results of the study. Our we had 170 infants, 340 eyes of 170 infants. 63 eyes of 33 infants were ROP positive. That means actually 3 babies, only 1 eye had ROP changes, and 2 infants had type 1 ROP changes, that is treatment requiring, while other eye had type 2 ROP changes. So the incidence rate came out to be around 18%. And around 22 eyes out of the affected eyes had type 1 ROP, and 41 eyes had type 2 ROP, that is non-treatment requiring. But we had a staggering rate of 22% aggressive ROP changes, and that is very significant in a study. So these are some of the result images using our own digital wide field imaging system. This one shows stage 1 zone 3 ROP, the second image shows stage 2 ROP. This is a stage 3 with extraretinal neovascularization, and this is a partial retinal detachment not involving the macula, stage 4 ROP. These are pre-plus diseases, and this is a plus disease showing a lot of tortuosity in the posterior pole. And these are aggressive ROP showing flat neovascularization and hemorrhages, mainly confined to the posterior pole. And these are some of the post-treatment laser images. So significant association of ROP was noted with cardiorespiratory support, oxygen therapy, septicemia, apnea, anemia, and low gestation age and birth weight. Coming to the discussion part, our study showed 18% incidence of ROP, which is comparable to around 20 to 40% reported in various studies done across regions in India. Our study shows 35% babies had type 1 ROP, that is treatment requiring, compared to 9.9% in a study done in a neighboring district by Bhatt et al. Aggressive ROP was very high in our study, that is around 22.22%. This is again very high compared to Hungi et al. Gestational age, now what was staggering in our study, and that is what I mentioned in need for study, that 8 babies with birth weight more than 2 kgs and gestational age more than 34 weeks, which is generally what we keep as cutoff, had ROP. Now, these babies would have been easily missed by other guidelines. So, we need to screen because variable level of neonatal care is generally seen. So, these are my references. Thank you.
Very nice presentation. Why you have noticed 35% of incidences in your cases as compared to others?
So 35% were treatment requiring. Of 35% of the total ROP babies were treatment requiring. Others were non-treatment requiring, which regressed with follow-up.
Okay.
18% is the incidence rate, sir.
What were the risk factors in your study?
The major risk factors were oxygen, respiratory distress syndrome, ma'am, cardiorespiratory support, and anemia, septicemia, and intraventricular hemorrhage. There are a list of other this thing. Just for the sake of this presentation, a few I have listed which were significantly associated, ma'am.
So what was the most significant? Because your paper mentions as risk factors in your title. So what were your...
Most significant was oxygen therapy, respiratory distress syndrome, and cardiorespiratory support, ma'am.
And the prematurity?
Prematurity, statistically it came out to be insignificant because 8 babies more than 34 weeks still had ROP changes. So statistically, although it was insignificant, but yeah, most of the babies other than the 8 babies were less than 34 weeks. So it is a significant factor, but statistically p-value was more than 0.05.
Ma'am, you want to?
Any relationship with the stay in the NICU?
Yes, ma'am. In the paper that we are coming out, we have included that. So increased NICU stay is significantly associated with the ROP development.
Because this is one of the important risk factors.
Yes,
Because
ma'am.
since
So-
you have mentioned a risk factor,
Yes,
and
ma'am.
stay in the NICU is one of the most important risks, whatever the etiology is.
Yes, ma'am.
Okay.
Because of mainly oxygen dependence, more oxygen dependence.
Not
as
only
with this,
oxygen
ma'am.
dependence, the septicemia,
Septicemia,
and
yes,
all
ma'am.
comorbidities.
Yes, yes, ma'am. Thank you.